Aloha! Today we are going to introduce the Center on Aging and discuss the ways that aging and older adulthood are impactful to our experience in many different capacities. The Center on Aging, also known as COA, is one of over 70 research centers and institutes at the University of Hawaii at Manoa. It was established in July 1988 by the University of Hawaii Board of Regents, reporting to the Office of the Senior Vice President. The center had subsequent moves under various leadership, but since 2016, COA has been housed under the Myron B. Thompson School of Social Work and Public Health. The mission of COA is to enhance the well-being of older adults through interdisciplinary and collaborative efforts in research, educational programs, and service to the community. It is focused often on applied, translational, and community-engaged research with attention on the multicultural populations of Hawaii and the Asia-Pacific region. Throughout this presentation, we will be using what is currently accepted as more age-inclusive terminology. This language is neutral in nature and is used to describe persons who belong to the age demographic of 65 years and older. The terms older adult, older person, and person over 65 are more specific to this population than terms like senior or elder, which can have a wider range of meanings. Overall, COA aims to promote collaborative and interdisciplinary research within the university and other academic and community partners, develop innovative programs of interdisciplinary gerontological education and practice, and provide state-of-the-art information to policymakers, program managers, clinicians, and the general public from diverse and culturally inclusive perspectives. Some focused areas of research and program development are persons with lived dementia and caregiver support, including the development of the updated Alzheimer's and related dementia state plan, nutrition and food security, which was key to serving older adult communities during the pandemic, social and health disparities, gerontological workforce development, primarily within the health and human services sectors, and aging-inclusive educational models. Before we jump into our discussion on aging, for those of us who have not yet reached older adulthood ourselves, it's helpful to first frame this idea from a personal perspective. Please take a few moments to consider the oldest person you know. How old are they or were they? What is or was your relationship with them? And what is something you learned from this person? I encourage you to pause the video to consider these questions. If you were able to bring someone to mind to answer these questions, you've already found one way you are aging connected. No matter where you are or your background, we are all engaged with the aging process as a shared experience. When we talk about aging, one of the concepts that comes to mind is life expectancy or longevity. In basic terms, life expectancy is calculated based on death probabilities for a given birth cohort at a certain point in their lives. This graphic depicts some of the general life expectancies seen throughout different historical eras. We can see that life expectancies did not change much throughout earlier human history. Dramatic increase took place only in more recent times with the advent of medical, technological, and social advancement, which helped people overcome previous barriers to aging. Overall, this progress is contributing to our growing older population. Through looking at the composition of our population, we can see some factors that contribute to the aging of a given society. This graphic shows us the historical and projected age makeup of our population in the United States. Notice that in 1960, there is a more pyramid shape with a larger amount of babies and youth at the bottom and a tapering off of older generations at the top. In comparison, we see somewhat of an inverse and bulging shape projected for 2060, where there are significantly larger numbers of adults and older adults compared to newborns and youth. Much of the rise in our older adult populations can be attributed to the baby boomer population reaching the retirement age beginning in 2011. The U.S., like other developed countries, has seen a slowing in birth rates over the years and an increase in the population of adults age 65 and older. This demographic shift, as seen in the previous slide, has many social and economic implications our global communities are not yet equipped to handle. Just because people are living longer doesn't necessarily mean they are maintaining their health as they age. As the number of older adults increases, so does the prevalence of aging-related and chronic conditions in these generational cohorts. Although we understand each phase of life looks different from a biopsychosocial perspective, it begs the question, how do we maintain a good quality of life across a longer lifespan? Locally, our older adult population in Hawaii has reflected the same steady growth as our global population. Population projections show that this trend will continue as the baby boomer population continues to age into retirement. The percentage of older adults in Hawaii's population as of 2023 is around 20.4%, and over half of the persons aged 65 and older identify as Asian. Hawaii currently holds the longest life expectancy in the U.S. Despite this fact, the life expectancy of specific ethnic groups varies. We can see that Asian populations have a higher life expectancy than our state average, and white and Pacific Islander groups have considerably shorter life expectancies. Although this data is from 2009, it demonstrates the overall idea that there are disparities in the way different groups age. Each of our aging processes are unique and are reflective of the experiences we've had at subsequent stages of our individual development. The social determinants of health outline various aspects of our built and social environment that can impact our well-being and quality of life. Barriers and supports in these areas within our specific contexts can impact our aging process across the course of our lives. An aging population has a multitude of implications for our society as a whole. For example, because of the lower birth rates and increase of those entering retirement, over time, there will be less adults of working age who are actively contributing economically to our communities. This has implications for our current system of Social Security and other social support services. Additionally, the way we perceive aging and the stereotypes we have for those in other generational cohorts can have a profound effect on the dynamics of our communities. With limited resources, we also need to better understand how to equitably allocate support and aid to individuals across the lifespan. Because these problems are multifaceted, no matter what field you decide to enter, from allied health professions, business, economics, social services, engineering, architecture, tourism, retail, marketing, food service to technology, aging will be meaningful to your practice. It's because of this fact that the Center on Aging invests in aging-related education and strongly believes that it should be widely accessible. Interdisciplinary collaboration is necessary to holistically address many of the current aging relevant social challenges we are experiencing. If any part of this presentation resonated with you and you'd like to learn more about the wide range of academic and community-oriented opportunities with the Center on Aging, please follow the QR code to sign up for our listserv, or send our team an email at uhcoa@hawaii.edu. We are also developing aging-related resources on our website, so please stay in touch and stay tuned.